Well, EMDR is a trauma treatment. EMDR stands for eye movement desensitization and reprocessing. It's quite a mouthful, so we just say EMDR. And it was discovered by Francine Shapiro in 1987. And she sort of discovered that if there's eye movements while you're thinking of a distressing memory, after you use some eye movements while you're thinking about that, the distressing memory is no longer so distressing. During EMDR, my job is to set up the protocol, which would be to identify the upsetting moment and what would be the negative core belief. And like the most popular ones that most of us struggle with in America is I don't matter, or I'm not good enough. And then we start the bilateral stimulation with the lights or the headphones or whatever, and they go back into that memory, and then the process starts. So with the light bar, which is just, it's just really almost as long as my arm could reach, and it has the blue lights or green lights. Mine is blue, and the lights just move back and forth, and the person just would watch these lights that would go back and forth on this light bar, and I have a little remote to turn it on and off. And it also has headphones that will beep alternately. You know, if the lights are on the left side will beep. And I also have these tactile stimulators. They're just little paddles you put in your hand, so they just vibrate alternately. So you can use all three of those. You can use one of those or two. Some people like the headphones, some people don't. People will often ask me, so I'm going to watch these lights. Is that like hypnosis, doc? I said, it's the opposite of hypnosis. In hypnosis, you're in a state where you're not really aware, you're semi-aware, and the therapist is using hypnotic language to cause some change in your unconscious. With EMDR, you're hyper-aware. You're in this mindful state of processing. You remember the memories, you feel the memories, your body is activated, everything comes alive. So it's kind of the opposite of hypnosis. We really, as therapists, we only say two things. We, every once in a while, will stop them and ask, what are you noticing? And they will tell us, well, my head's starting to hurt or my heart's racing, and then we'll say, okay, go with that. And those are the only two things we really say unless there's trouble. There's no talking during an EMDR session, so the next session we may have to talk. Because EMDR, we deal with this emotional material that's processed and resolved. And then because you're changing the internal mechanisms that people view the world, then the way that they engage the world starts to change. And the way that they engage others starts to change. And when that happens, there's trouble. Because nobody likes change. But Carl Jung said this wonderful, beautiful thing. He said, all true things change, and only that which changes remains true. So we're supposed to change and deal with it. And so I think I'm doing, the right thing. And they're better. They're happy. They're more okay with themselves, and they respect themselves, so they insist others respect them.